This week, we're talking with Sarah Coombs of the National Partnership for Women and Families about how women, and particularly women of colour, have been disproportionately impacted by COVID-19. For many women, the pandemic has widened the gender pay gap in what's being dubbed a she-session. A larger share of women than men have been laid off or forced to take unpaid leave. We'll find out the long-term impact of this and what needs to happen to mitigate the effects. From Free Speech TV, Just Solutions. Sarah, it's great to have you with us. There's so much to dig in this particular topic, whether we look at the economics of what's happened. As I said, it's been dubbed a she-session because of the disproportionate impact on women, but also the health implications of this. And I know you yourself have a strong background in health policy. It seems that when we're talking about the impact of COVID-19, we have to look at the intersectionality of this. Women being disproportionately impacted, but also particularly women of colour. So we're seeing once again the existing inequities along racial and economic lines in this country being exacerbated by COVID-19. Give us a broad sense of how women have been particularly impacted by the COVID-19 pandemic.
Sure, and thank you for having me. So first, I just want to say that, no one has been hit harder during this pandemic than Black, Indigenous, Latin, and AAPI women. These women and non-binary folks stand at the intersection of multiple oppressions and are bearing the compounded weight of systemic racism and gender inequities, among others, that have long existed before this pandemic. Women of color have faced a crisis upon a crisis with escalated virus threats, increased job losses, unmanageable care responsibilities, and escalated violent attacks against their communities, as we saw last week in Atlanta. So on the health front, for BIPOC communities, they have suffered disproportionately with higher rates of infection, hospitalization, and death rates. For example, last year, Black, Latino, and Indigenous people were about 4 times more likely to be hospitalized and nearly 3 times more likely to die from the coronavirus compared to white people. And on the flip side, they have also faced inequities in access to and barriers to testing and vaccines as well. And to put it in perspective, and when you zoom out and you look at the bigger picture, the CDC, the Centers for Control and Prevention, recently reported that the life expectancy for Black people fell by 2.7 years in just the first half of 2020. And for Latinx people, or Hispanic people as they identified it, was 1.9 years. That's compared to 0.8 years for white people. And when you think about it, life expectancy is the most revealing indicator of health disparities in our country.
I think it's important that we dig into that a little bit more, because it's very often that numbers and statistics just become numbers and statistics, and we lose sight of the fact that these are people, families who are being devastated by this. So when we talk about how we're seeing a reduction in life expectancy because of COVID-19, but also because of those pre-existing conditions, I mean, let's look at that further. Obviously, there are disproportionate representation of people of color, and particularly women of color, in these frontline industries who have been even more exposed than so many other parts of the population to COVID. But on top of that, they already had existing barriers to accessing healthcare, leading to pre-existing conditions. So sort of lay it out a little bit more as to why these numbers are there.
Sure. Well, I'm so glad that you raised the issue of employment. So, if there's one thing that we've learned from this pandemic so acutely, is that we cannot separate our physical health and well-being from our economic health and security. So first, this pandemic has showed us that women of color, as you said, make up the large shares of those employed in frontline jobs that carry the greatest risk of exposure to the virus. Second, we saw that Black, Latinx, and AAPI women accounted for all of the women's job losses in December. By the end of 2020, Latina women faced an unemployment rate of 9.1% and Black women 8.4%, while white women only accounted for 5.7% of unemployment. So, and then third, you have to think about the fact that we also saw a lack of a national paid leave program has exacerbated the harms to the health and economic lives of women of color. Sorry, go ahead.
Well, I just wanted to dig in more into the paid leave issue because, of course, COVID has placed an increased urgency on the need to have adequate paid leave. And we're seeing certain states taking this on really in response to COVID, but many other states not taking this on at all. And of course, all of this in the context of a lack of a federal response to the need to have paid leave. Because of course, this connects to COVID because so many children were then permanently at home because the schools were closed. And then women many times having to make the choice to either stay in the workforce or having to leave their job to be at home to look after the children, or sometimes elderly parents as well, because and it's not only women, but of course women are disproportionately the caregivers when it comes to childcare and elder care as well.
Exactly, right. So the US is the only industrialized nation in the world that does not have a universal paid leave policy. And as a result, as you mentioned, women of color and others have been forced to make the impossible choices of between protecting their health, caring for their loved ones, and earning a paycheck. And so it's certainly one of the issues that are at the core of the work that my colleagues in National Partnership lead on in advocating for passing a permanent paid leave program for all workers.
Well, paid leave, of course, is part of the bigger conversation around maternity leave or family leave when people are having children, you know, whether it's a mother taking leave off or a father being allowed to take leave off. This is woefully inadequate as well in this country. That's very much part of this conversation. And of course, maternal health care ties into this because we're already seeing such terrible inequities when it comes to maternal health, even prior to the COVID pandemic.
Right. Thank you for raising that. So, you know, as we continue to fight COVID-19, it's really important to not lose sight of the incredibly important battle that we face in the public health front, which also includes maternal health. So Black and Indigenous women are 2 to 3 times more likely to experience poor maternal and infant health outcomes than white women in the United States. The pandemic has only exacerbated these disparities. And so that's why at the National Partnership, we have been centering women of color, and particularly Black and Indigenous women, in our work to improve maternity care and to pass a more comprehensive maternal health legislation that would address this maternal health crisis. So one of the bills that I just really want to mention is the Black Maternal Health Momnibus, which builds on existing legislation to comprehensively address the crisis from every dimension, including expanding access to Medicaid coverage postpartum for up to 12 months. Right now, most women only have access to health coverage, or their health coverage stops at 60 days postpartum. And we know that maternal mortality and morbidity, or women continue to die up to a year postpartum. So it's so important for them to have continuous coverage throughout the duration of for a year after postpartum. But this Momnibus also comprehensively addresses the social drivers of health, It would provide critical investment to community-based organizations that have long been promoting health equity and have been improving maternal health outcomes for years. And then also, this bill would, help grow and diversify the perinatal workforce, because we know that people of color, especially women of color, are underrepresented in the health workforce, and that would be one major step in helping to narrow these disparities.
Arguments that are often put forward when there are efforts to put maternity leave or family leave, paid family leave programs in place are that small businesses just can't afford it. And it's very similar to the arguments that are made against things like a $15 minimum wage. And yet we do see that that is not the case. I mean, there are certain states that have much more generous benefits and do have some type of paid family leave. And if you look at the economics, this isn't something that's going to economically cripple the country. I mean, take us through the arguments that you have to battle when you bring up these policies and you say that this is for the benefit, not just of the community, but the entire country will benefit from these policies.
Right. Paid leave is a public health policy. It is we look at it as a health policy. We cannot, economic security and health security are inextricably linked. We cannot separate the two. And we have seen that, it has been so apparent in this pandemic that just providing paid leave is a huge solution to reducing risk of exposure. And then also just providing economic security for families. And so it's a no-brainer to myself, to my colleagues, and to other advocates in this space that we must pass a national paid leave program.
Well, we are hearing from a lot of viewers who were saying things like, well, Avi says, we need a country that puts health at the forefront, Medicare for all. Health is a human right. I mean, what is the intersection then between the policies that you're advocating for and this broader issue of just access to healthcare for everybody in the country?
Absolutely. So, we know that this pandemic just has shone a light on the health disparities in access to healthcare, and just underscored the reason why health coverage is so important during this crisis. So, the American Rescue Plan, which recently passed earlier this month, was the first significant advancement of the Affordable Care Act since its enactment. And what we saw was that it provided enhanced subsidies and financial assistance, and expanded eligibility for financial assistance. And it also provided financial incentives for states that have yet to adopt Medicaid expansion. And those provisions would help close the racial disparities in health coverage that exist. But we still have much more work to do. There are still immigrant families that still face significant barriers to health coverage and to accessing care. And so, we would call for greater expansions for health coverage, as we've seen that health coverage really, let's put it this way, it's really problematic when health coverage is tied to job-based security. And so we are just hoping for greater expansions and greater pathways for folks to have access to coverage so that we can, when there will be inevitably be another pandemic, that we're not facing the same issues of access to health coverage.
Well, I want to talk about some of the responses that it could really mitigate some of these problems that you're outlining, but really just also acknowledge the fact that this will have multi-generational implications. And because when you have particularly women who are stuck in a poverty cycle because of all the issues that we've outlined, that then gets passed on to their children, who then have a harder time getting out of poverty. This isn't just, the case of, well, this is happening at this particular moment. This has multi-generational implications. And so what are you hearing at the National Partnership for Women and Families? I mean, what are some of the stories that you're hearing directly from women about the choices that they have to make, that how they tend to be stuck in these situations? Because as you said, so often our healthcare, if you have a job, it's tied to that job, but that creates its own barriers for maybe moving moving on or taking chances to move on to a different job because of the risk of losing healthcare. I mean, what are some of the stories that you hear from women every day at your organization?
Sure. So, I would say for starters, we're a national advocacy organization. And so oftentimes we're hearing stories from other coalition partners that have membership organizations on the ground and that do have greater reach to folks on the ground. But you're absolutely right. We're hearing that this will have an inevitable effect for generations to come. And we already know that, just last year alone, 2.2 million women had dropped out of the workforce. That is huge. And that will have significant ramifications and implications for women's participation in the workforce going forward, and for their access to pay equity. And, we already know that there's a huge racial divide in the wealth gap. And so we need to figure out policies to help close that wealth gap, because that not only affects women, but it affects their families and their children, as you also have said. And one of the issues that I also just wanted to point out is that, as you had said earlier, the pandemic added a new urgency to the caregiving crisis in this country, as millions of women were put in an impossible position of managing both work and their family responsibilities. And so, at the National Partnership, we're building on the groundwork that we laid during the pandemic to push the Biden administration and to finally invest in national caregiving infrastructure through a suite of bills that would require, as we said before, paid sick and family leave for all workers, but also expanded affordable child care and services for home and community-based care, and ensure that paid caregivers get decent pay, benefits, protections, just like other workers.
Well, we're hearing from a lot of viewers. Linda says the inequities are glaring. And as we have been finding out, the COVID-19 pandemic has shone a spotlight on those inequities that were already existing. Avi says, how can we cultivate more empathy? And I think that's so crucial, because what I observe is that there's so much moralizing when it comes to poverty, and particularly from the right wing, from the Republican Party, that if you're poor, it's maybe the choices that you are making that are leading you to being in poverty. This idea that bootstraps, just pull yourselves up from the bootstraps, without acknowledging the systemic problems and barriers that people have to battle through, and how difficult that is under our current system. I mean, how do we create empathy, for that, and an awareness about that systemic nature of these inequities, when we have this moralizing and this attitude that comes through then in so many policies that, if you're in poverty, that's maybe because you're not working hard enough. There's the moralizing that goes with this.
Absolutely. The phrase personal responsibility just really strikes a nerve with me, because it really erases the systemic inequities that women of color, lower income wage workers, and others have been facing for so long. And so, I would say that we need to listen and center to the people and the voices that are most impacted during this pandemic. And that is what we're doing at the National Partnership. We've realized that there has never been a more pressing time to build a more just and equitable country. And that requires putting women and families of color at the center of our work. And that is what we're pushing the administration to do as well. And we have seen that, we've seen that the Biden administration, for example, has issued executive orders and established policy councils that center race and gender equity. And so, and we know that those issues will be a significant driver of his policy agenda and the public conversation over the next 4 years. So, we must hold the administration and policymakers accountable to that. And so I would just say, I would just really urge folks, in terms of your question about empathy, is really listen to the voices of the communities and the people that are most impacted, that have been most impacted by this pandemic. And you'll hear the stories, and it's so apparent that it's not just an individual problem. It is rooted in 400 years of history, of racist history, of a misogynistic system that we live in the United States.
And in terms of a federal response, I mean, as we are seeing this vaccine rollout, how do we centre equity, and how are women, and particularly women of colour, who, as we have been discussing, are disproportionately impacted, are they having access to the vaccines? Are they getting the healthcare that's needed just in this pandemic alone, aside from all the other health inequities that are existing?
Right. So, I mean, for starters, there has been a lot of a lack of trust in our healthcare system, which is just, Black Americans are hesitant to get the shot because of, as I said, the nation's history of racism in our medical research, and the current discrimination that we're facing today, that Black people are facing today. However, what was, I guess, heartening to read earlier this week, that the Kaiser Family Foundation issued a new poll of attitude towards COVID vaccinations, which shows that Americans are growing more enthusiastic about being vaccinated, with the most positive change in the past month occurring among Black Americans. And so it's so important to partner with community-based organizations, to partner with faith leaders and civil rights leaders and leaders in the community to spread information about how vaccines are safe and are necessary. And so I think, some of the things that the administration has been doing is, putting federally supported vaccination centers in high-risk neighborhoods, setting up mobile vaccination sites in medically underserved areas, administering the vaccine at independent pharmacies, and partnering with community health centers, and ensuring that high-risk facilities such as jails and homeless shelters have access to the vaccine as well.
And as we talk about a public health response, I know certain states are coming on board and acknowledging that racism is a public health crisis and poverty is a public health crisis, and acknowledging the intersectionality of all of this, and not just looking at things in silos, in vacuums, to see the systemic nature of all these issues that we're talking about.
Absolutely. I think, for starters, we must start with naming and acknowledging all the ways that systemic racism impacts the lives of BIPOC communities. And one of the pieces of legislation that I'd like to draw attention to is the Anti-Racism in Public Health Act that was reintroduced by Senator Warren and Congresswomen Presley and Lee. And they have called out systemic racism and the consequential inequities as the public health crisis that it is. And they propose a practical solution that improves the federal government's ability to develop anti-racist health policy. And one of the issues that I did not bring up earlier, but that is so important that this bill actually addresses, is the importance of data collecting and reporting on race and ethnicity, which is a huge problem in the United States. Without collecting data on race and ethnicity, we can't solve for what we don't know. And, I think the federal government, as we've seen in our healthcare system, they do not have the information it needs to adequately confront the racial disparities and health outcomes. And we've seen this particularly with the AAPI community, with Indigenous community and Latinx community. So I just really wanted to underscore that data collection and reporting point, because it is crucial, as the first step in identifying and addressing health inequities in our system.
Well, I know there's a lot more information about all of these pieces of legislation that you've mentioned today at the website for the National Partnership for Women and Families. Well, Sarah Coombs, it has been great to have you with us. Thank you so much for joining us on Just Solutions.
It has been a pleasure. Thank you.
And join us next week, same time, same place, as we kick off Earth Month with a very special Just Solutions from Free Speech TV.